I've been very passionate about breast cancer, breast reconstruction, all through my training. And as I was going through my training, it became obvious that quite a few relatives, friends, relatives of friends were developing breast cancer. And these were Black women, and they were developing breast cancer very young. So they were getting them in their 30s, in their 40s, and they were dying from breast cancer very young, or they had very aggressive forms of breast cancer. And so I became more and more interested in breast and breast oncology. And that's when I sort of decided that, as a minimum, what I could do is try to raise awareness of the fact that we do get differing outcomes as Black women from breast cancer. And if that then triggers something which can help to reduce that inequality, then that would be a positive thing. I mean, I think it's very important not just to listen. We always say to listen. It's really important to listen to what we are saying. And I think they are listening. I think there is an understanding. I mean, we've seen that with maternity, for instance. There is an understanding that there are a group of women who are not getting as good outcomes. And so there's that listening piece. But then there's the money, right? So it's how do we fund these things so that we can be very targeted about research, about interventions, about public health interventions, about screening. And it's not just breast cancer. I mean, we're looking at a plethora of different conditions. And a lot of these conditions have commonalities to them in terms of the risk factors or modifiable risk factors. So it's really about the money and how that money is spent, because there isn't a bottomless pit, but it's about how we target things so that we can maximize those outcomes for everybody.